AANP FNP study kit with complete questions and correct answers. Rated A+. A 65-year-old woman presents for a follow-up examination after a new patient visit. She has not seen a healthcare provider for several years. She is a smoker, and her hypertension is now adequately controlled with medication. Her mother died at age 40 from a heart attack. The fasting lipid profile shows cholesterol equals 240 milligrams per deciliter, HDL equals 30, and LDL equals 200. In addition to starting therapeutic lifestyle changes, the nurse practitioner should start the patient on 1. Bile acid sequestrant, 2. A statin drug, 3. A cholesterol absorption inhibitor, 4. Low-dose aspirin. Correct answer, a statin drug. Ortolani's click correct answer. A click is heard or felt as dislocation is reduced, developmental dysplasia of hip, good until 1 year. Which of the following laboratory tests should a nurse practitioner order when the suspected diagnosis is temporal arteritis? Correct answer, erythrocyte sedimentation rate, ESR. What are narrow therapeutic index drugs? Correct answer 1. Warfarin sodium, Coumadin monitor INR 1/4. 2. Digoxin, Lanoxin monitor digoxin level, EKG. Electrolytes, potassium, magnesium, calcium. 3. Theophylline, monitor blood levels. 4. Carbamazepine, Tegretol, and phenytoin, Dilantin monitor blood levels. 5. Levothyroxine, monitor TSH. 6. Lithium, monitor blood levels, TSH, risk of hypothyroidism. Otitis externa TX. Correct answer, fluoroquinolone and polymyxin B. Cortisporin drops. An elderly male patient complains of a new onset, left-sided temporal headache accompanied by scalp tenderness and indurated temporal artery. The AANP suspects temporal arteritis. What screening test would you order to assist with diagnosis? Correct answer, sedimentation rate. Expect to be very elevated. Basal cell carcinoma. Correct answer, pearly dome nodule with overlaying telangiectatic vessels. Could be plaque, papule, possible central ulceration, and crusting. DX, biopsy TX. Normal, healthy woman of reproductive age. Correct answer. White, clear, flocculent, physiologic leukorrhea, no complaints, pH 3.8 to 4.2, toward acidic, no odor, microscopic shows lactobacilli, gram-plus bacteria, multiple infections from bacteria and fungus? Correct answer. Screen for HIV. Screening tests. Correct answer. Sensitivity. Detect those with the disease. Higher the sensitivity is higher the false positives. Specificity. Detect those who don't have the disease. Erythromycin for chlamydia, eye infection in infants. Correct answer. 2/4. To assess PTS ability to think abstractly, a nurse pract could ask the patient. Correct answer, the meaning of a common proverb. The most commonly prescribed medication for mild systemic lupus erythematosus, is 1. Azathioprine, AZA. 2. Belimumab, Benlysta. 3. Ibuprofen, Advil. 4. Cyclophosphamide, Cytoxan. Correct answer, ibuprofen, Advil. A 17-year-old female is suspected of having polycystic ovary syndrome. In addition to testosterone, the most appropriate diagnostic test to order would be correct answer, follicle stimulating hormone, FSH, luteinizing hormone, LH, prolactin, and thyroid stimulating hormone, TSH. Barlow's maneuver. Correct answer, feeling of a slip as the femoral head slips away from the acetabulum toward the butt. Good until 6 mo. Candida vulvovaginitis. Correct answer, etiology, Candida albicans. 80 to 90%. White curdy, cottage cheese-like, sometimes increased. Itching/burning discharge. pH 4.5. Odor is usually absent. Microscopic shows mycelia, budding yeast, pseudohyphae. With KOH prep. Treatment: oral diflucan or vaginal miconazole or turconazole, pseudohyphae, clotrimazole cream. 3/4. Proton inhibitors. Correct answer, increased risk of fractures, postmenopausal women, pneumonia, Clostridium difficile infection, hypomagnesemia, B12, and iron malabsorption, atrophic gastritis, and kidney disease. Bacterial conjunctivitis, TX. Correct answer, eye drops or ointment. Polytrim, trimethoprim, polymyxin, macrolide. A patient with an elevated WBC greater than 11K, accompanied by neutrophilia greater than 70%, in the presence of bands is what kind of shift in prognosis? Correct answer, shift to the left. Serious bacterial infection. Actinic keratosis. Correct answer, rough, flat, dry, crusty. Erythematous papules or plaques. Scaly patch of red-brown skin, caused by years of sun exposure. Precursor to squamous cell carcinoma. DX. Biopsy. TX. Topical 5, fluorouracil 5, FU, cryotherapy. A patient with macular degeneration has deficit vision in? Correct answer, central vision. Dacerocystitis. Correct answer, typical symptoms of acute tear. Duct infection include pain, redness, and swelling of the lower eyelid at the inner corner of the eye, excessive tearing, pus or discharge from the eye, fever. TX. Lacrimal sac massage, rub down towards mouth. Oral clindamycin, topical tobramycin or moxifloxacin if mild. Purulent drainage, no redness. Pre-DM in children values. Correct answer, A1C. 5.7% to 6.4% powered by TCPDF, www.tcpdf.org. 4/4.